Georgetown University study shows that Nevada's small towns have had the biggest drop in uninsured children since 2008. And that's why new legislation is expected to hurt rural areas the most. Paul Nelson joins us live in the newsroom after talking to people about these possible cuts. So, Paul, why would small towns be affected more than larger cities?
Well, experts say rural towns generally have more poverty than big cities land, and the rate of Nevada's uninsured small town kids is just 7%, down from 21% nearly a decade ago. A big reason why is the Medicaid expansion in Nevada. 15 of Nevada's 17 counties are in rural parts of the state, and 37% of the children living there are on Medicaid, a program that could face deep cuts.
Nevada is highlighted in the report. Our small towns and rural communities are going to be some of the hardest hit in the entire country.
Senator Catherine Cortez Masto attended a committee hearing today, concerned that cuts could hurt smaller counties.
It's difficult in our rural communities just to even get some of our healthcare providers there. And then geographically, they're challenged. If they can't have access to healthcare there in their communities, they have to drive long distances.
Nevada's federal leaders say they want a bill that protects people with pre-existing conditions.
This is about people. This is about taking care of our families.
Katie Coombs lives with heart disease, a pre-existing condition she says could leave her out in the cold if the current health legislation passes.
It means higher premiums all the time, higher deductibles, and ultimately probably a lack of coverage for people who can't afford to keep up with that.
Dr. Andy Pasternak says the Affordable Care Act's not perfect, but that more people are getting preventive care and cancer screenings because of it.
We're able to pick up things before they turn into serious cancers, before they turn into deadly cancers. And so that in and of itself is probably one of the biggest improvements.
Cortez Masto says rather than a partisan solution like Obamacare and now Trump Care, Democrats and Republicans should work together to solve the health care issue.
Health care in this country should be affordable, and people should be able to access it, and nobody should die or go bankrupt because they can't afford health care. And that's what this fight should be.
As we mentioned, we probably won't know what's in the bill until tomorrow, but Cortez Masto says she expects many of the programs to get gutted. She says her focus will be to keep premiums low and the cost of prescription medications down. Covering the story live in the newsroom, Paul Nelson, Channel 2 News.